So everyone heard her introduce, but Kathleen, I want you to tell everyone how you would introduce yourself.
Bright. I like color.
Bright, beautiful, but you do so much more. Now, when we talk about advocacy, this is advocate #1.
So I was struck down in my prime of life, just like Kelly. I've been sick since childhood. You know the symptoms. I don't preaching to the choir here. You know, one day you can't get out of bed, everything hurts. You go in the sun, the next day you can't raise your arms above your head, you can't braid your hair or comb your hair. You look normal, everybody tells you you're a hypochondriac, a malingerer, you want attention, it's an anxiety disorder, you need to see a shrink. You get every infection that goes around. And for me, I also craved water. From the time I was a baby, my mother would get me out of a crib and my eyes would be stuck shut. What we know now is that's Sjogren's syndrome, which is a sister autoimmune disease of lupus. And I also always had cold hands and feet. And my father always said, cold hands, cold feet, warm heart. And I have a big heart. It wasn't until I was also in college that I got incredibly ill. I went to a Beach Boys concert and was out in the sun for 8 hours. The next day I couldn't get out of bed, horrible headache, couldn't see out of one eye. And I was in rural upstate New York, which is where I'm from, and there were no rheumatologists. But my grandmother had died of a disease called scleroderma the year before. And genetically, she was a redhead, Irish background, and very similar to me. A lot of digestive problems, and didn't like the sun. They were able to diagnose me, and that began my lupus journey. I can tell you that I have weighed 228 pounds on high-dose prednisone. I am living proof that there is life after prednisone, and you can get off it if you work closely with your physician. And that's the first part of advocacy, is being a self-advocate, being engaged and part of your treatment team. It is absolutely essential to survive when you live with any chronic disease, to become as educated as possible about the condition. And I'm not talking about going on the internet and reading every silly little thing that comes along, and prescribing to drinking cow milk upside down at midnight or some stupid thing like that. I'm talking about proven anecdotal researched evidence, and also connecting with a community. It doesn't always have to be a lupus community, but you're very blessed in this area because you have a wonderful lupus organizations to connect to. But to talk to other people who are walking the walk with you, because the people in your family don't understand what you're going through. Look at me. Do I look ill? I'm looking at all these beautiful people in the room. Very few of you look like you're ill to me. So it's like heart disease or diabetes. You don't wear your disease on your arm or your face. So it's connecting with people that know your story and can share your concerns and help you when you're feeling low. We all have bad days, and there's someone that we need to talk to. So whether it's a hotline or a support group or an online chat or a Facebook page or a Twitter community, whatever it is, that's self-advocacy. Number 2 is being part of your treatment team. You have to be engaged in your own health care. And it may take you years to find the right physician or healthcare provider that you connect to. It took me 20 years before I ended up where I am now, where I am absolutely part of my treatment team, as is my husband. No medical decision is made on my behalf without me having either a conference call or a conference table conversation with several of my specialists. And that's the way healthcare should be. We should be equal stakeholders at the table in the decision-making process. And don't let anybody else tell you otherwise, because it's your disease and you have to learn to live with it for the rest of your life. So very, very important to be part of your treatment team and to self-advocate.
Now, you mentioned a lot about your own personal advocacy. So how did you become a national spokesperson in terms of national lupus and autoimmune advocate?
Well, lupus took everything from me. It took my hopes, my dreams, my aspirations. I wanted to go to Europe. I was a language major. I wanted to fall in love with a prince and live the life of a romance character. But that didn't happen. I was dropped from the study group that I had signed up for at college. And all of a sudden, as I was weighing a lot more. I was on captain of the women's rugby team. I ran, I played soccer, and all those things were taken away from me because back then they told you, no exercise. Exercise is the worst thing for lupus patients, and we know that that's absolutely not true today, that the best thing you can do is exercise in moderation to move, to get off your feet, especially if you're on something like steroids or prednisone, where it's really hard not to gain the weight no matter what you do. So I then had to not go out anymore. And here I am in college, very sociable, and they say you take immune-compromising drugs and you don't want to be exposed to germs. So no social activities whatsoever. So try to go to college with no social activities, and no exercise, no extracurricular activities. And then they told my parents I probably wouldn't be alive in 5 years. So that was terrifying for them. And back then, that's what they said. You would get kidney disease and probably die within 5 years. It's not like that anymore. And as you can see, I've survived. But I wanted to give back to the community that had given so much to me. I connected to other lupus patients in support group. And I felt like a lot of them came to me for advice, and I had a voice. And my rheumatologist recognized this and suggested that I go to Capitol Hill with the American College of Rheumatology with a bunch of doctors and some other patients who had scleroderma, rheumatoid arthritis, Sjogren's syndrome. And I went to the Hill, and it was the most amazing experience of my life. I had a voice.
Now, are you suggesting that, you know, the people here get in a car this afternoon and drive to Washington?
No, I'm suggesting that you consider being an advocate. It is a powerful experience to go meet, whether it's with your state legislator, a county legislator, a Department of Health official, a public official, or your federal legislator, to write a letter or to make your voice heard. It gives you so much power to feel like you have a voice and someone is listening, and that voice can make a difference. But in order to advocate, you must know a few things, and you all know these things because it's you. You must know your data. You hear the word data all the time. You must know your numbers, and we all know our numbers. But when you're an advocate, your numbers have to be streamlined to get the attention.
So be
of
informed.
officials. Be informed. Know your numbers. For example, how many diseases you may have, how many drugs you take, what your health care costs are, either monthly or annually, and anything outrageous like I'm waiting for a kidney transplant, or I'm on dialysis, or I have a port, or whatever it is that's compelling enough to get their attention. How much are your health care costs? I take 38 drugs a day. My health care costs are $158,000 a year. I have a port. I'm infused every 2 weeks for 7 hours at a time. And I'm blind in my right eye and have a $10,000 device. Those are numbers that are impactful and make legislators listen to understand the cost and burden of a disease of lupus.
And if you don't know, for instance, everyone in your legislative district, if you know you can't get an interview with the senator, does that mean you cannot talk to legislative committees? Does that mean you cannot meet with someone on Capitol Hill who can at least hear what you have to say?
If you are a constituent, which means that you live in someone's district, and you are making a trip to Washington, or you want to meet with them locally in their local legislative office, you just call or email their scheduler, and you make an appointment. And you will, as a constituent, have a meeting with someone in that office. I know that we have a very wonderful advocacy day in March every year through the Lupus Research Institute and now the Alliance for Lupus Research. And we bring people affected by lupus, whether directly or family members, to Capitol Hill, and we have a wonderful event each year where you go around the Hill and you meet with your legislators and you talk to them, you tell them your story, and you tell them what you want. Usually we want increased NIH funding, as Dr. Collins told us last night. The NIH budget has been cut for many years, and we need federal funding for research. And there are lupus programs and lupus bills that we advocate for as well.
And of course, the FDA also has a voice, and you have a voice at the FDA. Tell us about that.
So as you heard Brenda say, that one of the highlights of her life was going and testifying before the FDA advisory panel in 2010 on a potential new treatment, Benlysta, the first biologic for lupus.
And for 12 years, the lupus community went to the FDA and asked them to have a voice on the federal advisory panel. They had arthritis patients and not lupus patients. And a lot of us applied for it, and I was very lucky to be chosen 5.5 years ago. And I am the lupus patient rep at the FDA. And I actually have a vote when new lupus drugs come up before the panel. So I was actually sitting there across the table when you testified. And that day was a wonderful day, as anyone who was there can tell you. I know Peggy was there. There were over 300 people. We had 3 straight hours of testimony from lupus patients and patient advocacy leaders. And it was so amazing to see the entire lupus community come together on behalf of the patient to try to get the first new treatment in 56 years. And it was wonderful to be part of that process. And anyone in this room can apply to give testimony at the FDA or on other issues that are important. And we put those up on our website when they're current. And you usually have 60 days to give public comment, and you usually just have to write your story down, and you submit it electronically, or you can fax it in. And it's a wonderful way to feel like you're making a difference and part of the process and the solution.
What's been perhaps the most rewarding part of being an advocate for you?
Well, I guess I can tell you the story of a congressman. The second time I ever went to the Hill, it's very intimidating when you meet with a congressman, when you think how powerful they are, or a senator. And I sat there, and you get emotional because you tell them what lupus has done to you, and it's very emotional to tell your journey. And I always like to say that I represent 51 million other Americans who have autoimmune disease and the 1.5 million lupus patients, my lupus warriors, as I call them. But I was telling him my story, and I said, I know now that I could have been a doctor, I could have been a lawyer, I could have been a politician, or even a judge. But lupus took that from me. I'll never be a mother, a grandmother, or ever have a career or financial security. I'm disabled. And I said, so there's so many things I could have done with my life. And he actually got down on his knee next to me, and he put his arm around me, and he said, my dear, you are doing so much more with your life than anybody else I've ever met. And what you do makes such a difference to the community. You're changing healthcare. You're making your voice heard. So just keep on advocating, because that's what you were born to do. So thank you very much. And that always stays with me whenever I'm telling my story to someone, is that you are making a difference by telling your story. And each time you tell it, you get a little better at it. You get better with your numbers and more impactful with it, and you learn what the buttons are that make people listen to you. But it's so important to tell about your lupus journey.
And she is all of us, don't you think?
So I just wanted to end my part with a poem that I wrote years ago. My best friend was diagnosed with lupus at that time. 18 years ago, she was the first lupus patient in the world to have a double lung transplant. And then because of the anti-rejection medication, 3 years later, she had an open heart transplant. And she was just a medical miracle. She lived for 17 years before passing away, which was unheard of. And I wrote this poem for her, but when she passed, she told me that I was to give it to the entire lupus community. So I give it to all of you. The butterfly symbolizes heroism in its continued survival against enormous odds. From its incredible transformation and rebirth to its amazing existence despite facing great opposition, this fragile creature is the embodiment of hope. Like the butterfly, the lupus patient continues to survive in a complex world, triumphing over each adversity every day with tremendous grace, dignity, and courage. And that is all of you. Thank you very much for the opportunity to be an advocate for you.
Thank you all so very much for being so supportive and caring and understanding, because I feel like I have a closeness to each and every single one of you, because I think it may sound very selfish to say this, as tough as it is to be someone who has lupus, it is also especially tough being someone who supports and loves and cares about someone who has lupus, because we're the ones who have to watch you suffer and go through it. And there's nothing we can do except be supportive and love and care for you. you get the drugs and you get the things that can help you. And there's nothing that can help us except to see you finally, we hope, get a cure. Thank you.